Now it's time for Toker Talk Radio, the voice of the marijuana nation.
What are you people? On dope?
Where you can toke.
I inhale frequently.
Or you can talk.
I experimented with marijuana and didn't inhale.
Or you can toke and talk.
10 federal criminal penalties for possession of up to 1 ounce of marijuana.
While we talk about toke on Toker Talk Radio.
So, by the way, when it comes to pot, if you're 40 years old, you live in a log cabin in Oregon, you got 12 giant pot plants in your backyard, have a ball.
Live from beautiful Portland, Oregon at Rolla J Studios.
Hey, this is great.
Yes, cannabis.
Plus your calls live at 971-533-7111.
They're walking on their pants with their cap on backwards, listening to Enema Man and Snoopy Poop Dog.
What's to keep somebody from getting all potted up on weed and then getting behind the wheel? Gateway theory doesn't work. It's a reality.
Holland, is it real? Don't tease me.
We're locking up people that take a couple of puffs of marijuana, and the next thing you know, they got 10 years.
And now, here's your host, the guru of ganja graphics, the sultan of sativa statistics, and the worst nightmare of a reefer-mad prohibitionist. A polite, perspicacious, productive pothead with a propensity for PowerPoint. Radical Russ Belville.
Yeah, good day, tokers and tokettes and non-toking lovers of liberty. It is Friday, March 18th, 2016. We made it. We made it to the weekend, everybody. And what a beautiful weekend it is right here in Scottsdale, Arizona. It's about 89 degrees outside. The sun is shining. Sky is clear. Make sure you stay tuned as well, because coming up in just 1 hour, we've got the Stoner Jesus Show live here on CannabisRadio.com. And remember, you can tune into CannabisRadio.com any time of the day, 24 hours a day, and catch something good. We've got a lot of great shows. Also, you probably know that we've signed Tommy Chong. The episode 2 of the Tommy Chong podcast is now available for on-demand download at CannabisRadio.com. And coming up on the next episode of the Dr. Dina Show, she'll be speaking with Whoopi Goldberg about her cannabis use. So all sorts of great content coming up here on CannabisRadio.com. Log on for more details. Now, while I'm here in Arizona, I've been focusing on some of the Arizona politics, and maybe next week even, I will get a chance to engage some of the marijuana legalization campaigns that are going on here. So we're still working on that. I'll keep you posted. This Saturday, there's supposed to be a Bernie Sanders rally. I guess that would be tomorrow, wouldn't it? A Bernie Sanders rally in Phoenix. We are going to try to get Cannabis Radio there with a press pass, and if so, cross your fingers, folks. I might get to interview Bernie Sanders. It's nothing for sure, and it's a long shot, but I'm crossing my fingers, because if I get to feel the burn with Bernie Sanders, that'll be, another item off my bucket list that I can cross off. So we'll keep you posted on that. Follow me at Radical Russ on Twitter, and I'll make sure to keep you all updated. And speaking of Phoenix, I was on the Phoenix Evening News last night on their CBS affiliate, CBS 5. If you've been following my Facebook or Twitter feed, you've probably already seen the video. They basically wanted to do a feature on Cannabis Radio, since it's based here in the Phoenix area, and about me and my mission to legalize through all 50 states. And the tie-in was the video of my tattoo. Those of you who've been listening to me but haven't seen pictures, you may not know that I've got a shoulder-to-shoulder back tattoo of the United States, and I've been putting a pot leaf in every city where I perform, where I do my show or I do a presentation or cover an event. So that was the subject of the video, and got a lot of response from people so far on this. I've got the audio for you, so you can at least hear what we had to say on the local evening news. So here it is from CBS 5.
Call them cannabis crusaders. A Valley business is taking marijuana advocacy online using internet radio.
And as Derek Stahl reports, one of their leading voices is backing up his efforts with black and green ink.
Welcome back, everybody. Time for our Hemp Day Hump Day update. And joining us,
Russ Belville is on the air to clear up the smoke around cannabis.
My show is the NPR of POT. We are a 2-hour live daily talk radio program covering all aspects of medical marijuana, consumer cannabis, and industrial hemp.
Radical Russ is one of a growing list of pot personalities on Scottsdale-based CannabisRadio.com.
You heard it here first.
Which bills itself as the internet's premier provider of cannabis content.
The fiber strength wouldn't be as good. The seed oil content would be degraded. Can you get into that detail? This show is all about spreading the message of cannabis legalization across America and around the world.
And Belleville is mapping his legalization effort in permanent ink.
What I learned is that the East Coast is more painful than the West Coast.
Why is that?
Because of all the squiggly lines.
He puts a marijuana leaf in every city he's broadcast from.
We measured LA to Atlanta on my back, and then scaled Alaska to that size.
And puts a green border around states that have passed recreational use.
I'm not stopping until all 50 states are legal. I'm not stopping until nobody has to fear a drug test for their job. I'm not stopping until every patient who needs medical cannabis can get it.
He says 2016 could be a big year for his tattoo artist, with 5 states, including Arizona, considering legalization measures.
If cannabis had never been called marijuana and had never been an illegal drug, and we just found it in the rainforest last year, we would be clamoring over what a miracle cure this was for so many ailments. For everyone here in Scottsdale at Cannabis Radio headquarters, I'm Radical Russ. Thanks for joining us, and until next time, take care of each other, tokers.
Derek Stahl, CBS 5 News.
Big thanks to Derek Stahl and the CBS 5 News crew, Chris, his photographer, and of course, my unending thanks go out to Thomas Barrington and Lucky Horseshoe Tattoo in Fort Worth, Texas. Increasingly becoming one of the best decisions I ever made. Stay tuned, folks. We got more when we come back from this 2-minute break. We're going to talk about legalizing all drugs. This is a new article in Harper's magazine, gaining a lot of attention today. Be right back.
This is the Russ Belville Show on CannabisRadio.com.
Dr. Dabber, hurry! Its temperature is shooting past 1,000 degrees Fahrenheit. It's burning up.
I'm afraid for this little guy, it's just too late.
What caused the problem?
Only Dr. Dabber can maintain the perfect temperature for a smooth-tasting, slower burn. This standard vaporizer lost all of its health benefits, sending it up in smoke.
So you're telling me that most vapor pens burn so hot they produce smoke, not vapor?
Correct. Keep away from those standard vaporizer pens and turn to Dr. Dabber. Doctor's orders.
Less heat, more flavor.
How high do you like your profit margin? CannabisRadio.com.
New beginner guitars and banjos are often constructed much better than ones built before your time. Why struggle? Get a new instrument or fix the old one. The trusted professionals at the Fingerboard Extension will evaluate your instrument for free. Repairs are priced for people who work for a living. Stop by the Fingerboard Extension downtown Corvallis at 120 Northwest 2nd Street today, or check out its inventory on the web at fingerboardextension.com.
The Russ Belville Show is blogging and podcasting daily at RadicalRuss.com.
Ignite the conversation on some trending topics along the Cannabis Radio social media network. Join our crew of thousands on our Cannabis Radio page on Facebook or at Canna Radio, CANNA Radio on Twitter. Plus, look for our Facebook and Google Plus pages for all of our original programs and connect with Dr. Dina, Kyle Cushman, Dr. Mitch Earlywine, Nurse Heather, Doc Rob, the hosts of Ganjapreneur, and more. Connect with the growing Cannabis Radio social crusade at Canna Radio on Twitter or search for Cannabis Radio on Facebook, Google Plus, and Instagram and grow with us.
Pod 2.0. It's not your father's Woodstock weed. This is the Russ Belville Show on CannabisRadio.com.
Welcome back, everybody. We got 9 after the hour here at Cannabis Radio. So glad you could be back here to join us. There's a great article up on Harper's magazine, harpers.org if you want to find it. And it's called Legalize It All. This will also be in the April 2016 issue of Harper's Magazine. A cover of a woman's mouth with a yellow jacket pill in between her teeth. And it's a very telling article. It begins with some history that a lot of people don't recognize or don't accept or understand. That is a very, very telling piece of history in the history of the war on certain American citizens using non-pharmaceutical, non-alcoholic, tobacco-free drugs. And it dates back to the Nixon administration. Richard M. Nixon, good old Tricky Dick Nixon, who won election in 1968 and through his first term ratcheted up what we now call the war on drugs. And this was when Richard Nixon literally declared war on public enemy number one, the scourge of dangerous drug abuse in America. Now, the article written by Dan Baum opens by talking about how he was writing a book about drug prohibition and got the chance to interview John Ehrlichman. Now, Ehrlichman was one of the Watergate co-conspirators, did prison time for it, and, of course, worked for Richard Nixon. He was Nixon's domestic policy advisor. So Baum was interviewing Ehrlichman for his book on the war on drugs and asking him a whole bunch of policy and wonky questions when Ehrlichman said the following, quote, You want to know what this was really all about? The Nixon campaign in 1968 and the Nixon White House after that had two enemies, the anti-war left and the black people. You understand what I'm saying? We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and the blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did. End quote. That's John Ehrlichman from the Nixon White House, pointing out what we've all known deep in our hearts, that this was never anything to do about the qualities of marijuana or drugs themselves, but the qualities of the people that were using those drugs or those who were perceived to be using those drugs, and to use that prohibition as a political tool to control these so-called undesirable elements in our society. And of course, it was a rousing success. This is something I often point out when people have this, especially in our movement, we have this little bumper sticker saying, we say, the war on drugs is a failure. And I say that's not true. I say saying the war on drugs is a failure is to misunderstand what the purpose of the war on drugs was in the first place. If you understand that its purpose was to interrupt, infiltrate, and destroy the anti-war left and the power of black organizing, then it was a rousing success. If you understand that the war on drugs was about protecting pharmaceutical profits from the competition that they would face from a legal plant they could grow that would relieve pain, inflammation, insomnia, anxiety, nausea, spasms, seizures, etc., etc., etc. If you look at it from that perspective, it's been a rousing success. It's kept the price of marijuana artificially high and the number of users artificially low. If you look at the war on drugs as a method of sustaining our addiction to oil and not giving us an alternative through hemp seed oil or biomass fuels, then the war on drugs was a rousing success. If you look at this as a jobs program for the underserved inner cities, it's been a rousing success. Consider that. Consider how many people in underserved underprivileged neighborhoods are just getting by, just making ends meet, just barely able to pay the bills by slinging a dime bag here and there. If that didn't exist, how much greater would unemployment and income disparity be in some of those neighborhoods? By continuing a war on drugs and turning over the street-level retail sales of drugs to the underprivileged communities, you artificially depress how many of them are going to be applying for social benefits or unemployment. You take away part of that pressing need to provide jobs for the youngest, most disaffected members of that community. So in so many ways, the war on drugs has been a rousing success for the people who want that war to continue. And only through understanding that can we begin to battle the people's perceptions on stopping this war on drugs. And this is something that's important for those of us in the marijuana community to start considering, because one of the pushbacks we're going to get now as marijuana legalization becomes almost a fait accompli, people just accept that it's inevitable, and eventually even Kansas will legalize, or North Dakota or Iowa. As that becomes more and more a part of our common understanding in this country, some of the pushback we're going to get is, legalizing marijuana is one thing, but legalizing all drugs, we'd never want to do that. Marijuana is one of the good ones. Not like those bad drugs, heroin, cocaine, meth, LSD, mushrooms, ecstasy. And indeed, I brought you some data yesterday on the show that showed American support for marijuana legalization, decriminalization, medicalization, all well into the majority. But for any other drug, doesn't even break 20%. And for most of the harder drugs, doesn't even break 10%. And this could be used against marijuana reformers. It's very easy for an opponent to put us into that slippery slope frame. Once we legalize marijuana, what's to stop us from legalizing coke or meth or heroin? Or being used as a gotcha question. So if you support legalizing marijuana, do you support legalizing methamphetamine? And I always counsel people on our side, if you get caught with that question, don't let them pin you into saying that you want to legalize all drugs. Even though, personally, that's my goal. I want to legalize all drugs. That's LEAP's goal, Law Enforcement Against Prohibition, legalize all drugs. Drug Policy Alliance, legalize all drugs. Now, it's important that you have a caveat there that legalize is a really broad spectrum that runs from aspirin to morphine. So, legalize what legal heroin looks like or legal cocaine looks like is going to be a far cry from what legal pot looks like. But the problem is once you step into that legalization arena, now you have a whole lot of splaining to do. And that's going to make it tougher to make the point. When I'm confronted with that point, you want to legalize marijuana, would you legalize meth? My answer is always, no person should be imprisoned or criminalized for what they do to themselves. This answer flips the script and puts the onus back on the prohibitionist to explain why we need to criminalize and imprison people who use drugs. Because that's the status quo. Don't get yourself caught too much in having to defend and promote legalization so much as forcing them to defend prohibition. Let's hang that albatross around their neck, that millstone, as much as we can. Let's drag them down with the status quo. Let's make them own that. You guys own prohibition. That's your gig. You're the ones who want to lock people up for having an addiction. And they can't defend that. That's not defensible. And that takes them off their game of trying to paint you as the wild-eyed libertarian who just wants everybody roaming free, getting high on whatever they want. Make it about the solution has nothing to do with imprisonment and incarceration. Now, as far as understanding this war on drugs from the point of Ehrlichman,
that's just how white folks will do you.
Somehow, Liebermater manages to pick out the perfect 20 after break for that subject. All right, we're going to take a break. Happy 420 from Scottsdale, Arizona. We're live on CannabisRadio.com and back right after this.
Tommy Chong Show on Cannabis Radio. You know, about this podcast, what I really want to do from now on is to solve world problems. I feel like my job is to calm everybody down and focus on how we can save this planet.
The Tommy Chong Podcast, only on CannabisRadio.com.
Welcome to my world.
You're listening to the Russ Belville Show on CannabisRadio.com, where we don't change our mind on decriminalization during an election year.
NORMAL stands for Responsible Adult Cannabis Use. If cannabis use is causing problems in your life, consider taking a break or seeking medical assistance. Consider ceasing cannabis use if you have a family history of mental illness. Don't drive or operate heavy machinery while impaired by cannabis use. Cannabis use is not without risks, even though the risks are far less than those posed by legal drugs.
Seed to sale, clicks to conversions, and more. You're listening to the Cannabis Radio Network.
The Russ Belville Show is proudly sponsored by the Marijuana Business Association. The MJBA, called by NBC News the Cannabis Chamber of Commerce, is the fastest growing business association in the fastest growing industry in America. I've been working with the MJBA for years, and I personally invite you to join the MJBA. MJBA also publishes the popular MJ Headline News on Facebook and the MJNewsNetwork.com and Marijuana Channel 1 on YouTube. Visit mjba.net for more details.
Most of us pirates, we go on vacation to North Dakota, you know, because they've got a town called Argusville. What are you smoking there, boy? This is Dan Michaels from DanMichaelsAudio.com, and you're listening to Radical Russ on CannabisRadio.com.
Welcome back, everybody. 22 after the hour. Hope you had yourself a great safety meeting. We're talking about this article that is going to be the cover story on Harper's magazine. It'll be on the newsstands. Might even be out on the newsstands now. It's entitled Legalize It All, How to Win the War on Drugs. And a really interesting point about this that needs to be reiterated is how we convince the American people that the legalization of all drugs wouldn't lead to crazed mayhem in the streets, rioting, looting, sky falling, cats and dogs living together, disasters of biblical proportions. We need to convince them that that's not the case. And part of this is going to be to puncture the mythologies that surround drug use. You know, largely, people believe in what I call the Jekyll and Hyde theory of drug use. They figure that during your sober moments, you're Dr. Jekyll, you're fine, you're intelligent, you're a good person. And then you take drugs, and it completely changes you into Mr. Hyde, into this terrible, evil creature consumed by the overwhelming desire for drugs, bereft of any sort of moral center. It's that demonization of the drug user as a vampire or a ghoul in society, a predator of some sort, a deranged, depraved individual. And the facts are that that is just not true. Most people do not have a drug problem. And I don't mean just most people, United States, most people. I mean most people that do drugs do not have a problem. Most people that do drugs use them in much the same way people use alcohol. We don't think of alcohol and then immediately think that the people that use alcohol are all a bunch of fallen in the gutter, puking on the shoes, fighting with everybody drunks. We do recognize there are such things as alcoholics. And we do recognize that some of those alcoholics can become quite antisocial. But we well understand that that is by far the exception. we well understand that most people that drink in our society drink in a social manner, don't have any problems with their drinking. It doesn't affect their life in any negative sort of way. And that's exactly how drugs are for most people that use drugs. In the Harper's article, they write, the government's own data from the Substance Abuse and Mental Health Services Administration shatters the myth of instantly addictive drugs. Although about half of all Americans older than age 12 have tried an illegal drug, only 20% of those have used one in the past month. Let's reiterate that. Half of the people in America have tried drugs. Only 1 out of 5 of them have used one in the last month. In the majority of those monthly use cases, the drug was cannabis. So, half the people, and then you take 1 out of 5 of them, so now you're down to 1 out of 10 of all people, right, have used drugs within a month, and most of those people that have used drugs within the month were smoking pot. You end up with only a tiny percentage of people who have sampled one of the big 4 drugs: heroin, cocaine, crack, and meth. Only a tiny percentage have used that drug in the past month. For heroin, it's 8%, cocaine, 4%, crack, 3%, meth, 4%. And that's of the people who have tried drugs, right? That's only half the people who've tried them. And of them, it's 8% or less that are actually using it this month. And it isn't even clear that using a drug once a month amounts to a drug problem. The portion of lifetime alcohol drinkers who become alcoholics is 8%. And we don't think of someone who uses alcohol monthly as an alcoholic. And that's the other part too. You know, we've heard this in the propaganda that Kevin Sabet and Project Sam acolytes always push. You know, people that smoke marijuana as adolescents, they have a much greater chance of becoming addicted. 1 out of 6 will become addicted to marijuana. Well, how do they define addicted to marijuana? They define it as someone who shows up in that monthly user stat. So all they prove is 1 out of 6 of the people who try marijuana as teenagers becomes an adult who uses marijuana monthly. Isn't that also telling us that 5 out of 6 of the teenagers who try marijuana don't go on to become monthly adult users? And then, as this points out, if you're a monthly adult cannabis user, does that in and of itself tell us anything about whether or not you have a problem with marijuana? Well, no, of course not. Monthly use of cannabis can be the guy who once a month likes to smoke a joint on a weekend or a 3-day weekend with his wife or something. Once a month use of cannabis could be the people who only smoke on the weekends. They only smoke on the weekends. The rest of the weekdays, they stay clean and sober. Once a month cannabis users could be the people who do smoke every day, but they only smoke after work when they get home and they want to relax. Like somebody who might drink a glass of wine every day after work. We wouldn't necessarily say they're an alcoholic. And the other problem with determining who is a problematic cannabis user has to do with the very methods our psychologists and psychiatrists use to make that diagnosis. They use something that's known as the DSM-5. This is the Diagnostic Statistical Manual, and it's basically the guide for psychotherapists, psychoanalysts, psychologists, to be able to diagnose people with mental disorders, mental illnesses. And so there is now in the DSM-5 something that's called a substance use disorder. And it applies to any substance. It could be coke, meth, heroin, alcohol, and of course, cannabis. So in this substance use disorder, they've got a checklist of like 11 different things that could be indicative to a physician that you might have a issue, a dependence, a problem with cannabis. And so you go through this checklist, and what you end up finding is a lot of questions that don't tell us anything about whether someone's got a problem with cannabis, but tell us a lot about whether they've got a problem with prohibition of cannabis. For example, one of the standard questions has to do with, do you find yourself spending a lot of time in trying to acquire your substance? Well, Yeah, because I live in Kansas and I got to call a guy who's got to call a guy who's got to wait for 2 hours, who has to go make a trip, who has to go to the ATM to meet in a parking lot at the wall. Yeah, that might take a little time. Right? So how do you use that as a criterion for whether or not someone's got a problem with cannabis when if we were talking about potato chips or Coors Light, do you spend a lot of time gathering up potato chips and Coors Light? No, I go down to the Walgreens, I buy some potato chips and Coors Light, we're done. So that's a dumb question. Another criterion they have is, has your use of the substance led to any sort of problems at work, school, or with law enforcement? Well, yeah, because it's illegal. Because they P-test me and they find out that I've been using it. And then they kick me out of school or they suspend me at work. Or, God forbid, they fine me or throw me in a cage if it's the cops. How can that be a criterion as to whether or not you've got a cannabis problem when that problem wouldn't exist but for the prohibition of the cannabis in the first place? And there's so much more that make it so problematic to try to determine whether someone's got a real dependence issue with cannabis. Now, I should add this disclaimer. This is not at all to say that there are not people out there who have a problem with cannabis. People can become addicted, dependent in a dysfunctional way with cannabis. Let's be clear. It's not for everybody. There are people who can develop a very unhealthy relationship with cannabis, as they can with alcohol, or gambling, or hoarding, or sex, or porn, or exercise, or any number of things that people can develop a dysfunctional relationship with. But as we're learning, and Johann Hari has a great book out called Chasing the Scream that you should really check out. And another person who's been doing a lot of work on this is Dr. Carl Hart from Columbia University. And both of them tell us that what we know about drugs is wrong and what we know about addiction is wrong. And that addiction isn't so much a chemical bondage to drugs as it is a lack of human connection. For example, we think of heroin as being something, oh my God, you shoot heroin, you'll become a heroin addict. You'll be a junkie because you'll be chemically addicted. You'll need that opium. You'll need that morphine, that heroin in your system, or you'll get sick. But then Johann Hari points out that we have people that go to hospitals all the time and they give them diamorphine, which is heroin, right? They give them these painkillers for their broken arm or their hip replacement or whatever. And when they get out of the hospital, they don't all turn into addicts. Why is that? Because it doesn't have so much to do with the chemical as it has to do with the person and their situation. It goes back to an experiment that was done called Rat Park. See, they'd always tried to figure out how addiction worked by testing rats. Because, it's unethical to take 50 people and divide them into two groups and give half of them heroin and half of them a placebo, right? You got to use rats, okay? So they've always set up these experiments where they put a rat in a cage and they give him one bottle of water that's got cocaine water and the other bottle is just regular water. And what do you know? The rat just keeps drinking the cocaine water until he overdoses and dies. But this one researcher said, well, wait a minute. You're putting this rat by himself in an empty cage with two choices, cocaine water and nothing else to do. It's not the rat, it's not the cocaine, it's the cage. And so what this guy did is he figured, maybe if these rats had something else to do, something else in life to look forward to other than the high from cocaine, maybe they wouldn't get addicted to it. So he created what was called Rat Park. Rat Park was like Disneyland for rats. There's like little tunnels to crawl through, and there's plenty of other rats, boy rats and girl rats. They could have rat sex. They could run in little spinning wheels. They had food and bedding and all sorts of fun, and the cocaine water and the regular water. And in Rat Park, the rats very rarely, if ever, used the cocaine water. None of them overdosed. None of them died. So what do we do when people are addicted in this society? Why, we put them by themselves in a cage. The very worst thing that we could do. We cut them off from educational opportunities, from employment opportunities. We deny them health care. We deny them benefits, unemployment. We drug test them for welfare. We do exactly the opposite of everything we should do to help people get off drugs. You want to get people out of addiction, off of drugs? Give them human connection. Plug them back into society. Give them a helping hand back into the world of the living. All right, we're going to take a break. 2 minutes. We'll be right back with more on this Harper's article, Legalize All Drugs, on the Russ Belville Show.
This is the Russ Belville Show on CannabisRadio.com.
The next generation of vaporizers has arrived. Vuber vaporizers are blazing the way with unparalleled technology for oil, concentrate, or dry flower pens. Providing unsurpassed customer service and expert craftsmanship, Vuber vaporizers use cutting-edge technology, providing a power-packed, smoother vapor with a lifetime guarantee. Experience vaporizing the way it was meant to be. The Vuber way.
Every strain, every sale, every medical study. Keep it right here on the Cannabis Radio Network.
Hey everybody, it's Radical Russ here from 420 Radio, inviting you to be like me and get your ink done at Lucky Horseshoe Tattoo, Fort Worth's most female-friendly, clean, sterile, awesome tattoo shop. Thomas and his crew are true artists who can design you a custom piece or use a design you bring in. Lucky Horseshoe Tattoo also offers all styles of tattooing as well as piercings and all-around fun. In the DFW area, stop by Lucky Horseshoe Tattoo and tell them Radical Russ sent you. Trust me, it'll feel awesome.
The Russ Belville Show. Chat is for friends 18 and older. We expect our chat to be civil, mature, and free from excessive profanity. If you don't like these rules, there are approximately 6 billion other chat rooms with lower standards.
Tommy Chong is ready to cut through the smoke and change the tone of Tilk Radio.
All you have to do is decriminalize. We don't need a government regulation to tell us this is good pot, that's bad pot. We don't need any of that.
The Tommy Chong Podcast, only on CannabisRadio.com.
Welcome to my world.
I have a package here for Radical Rick. Is there a Radical Rick here? How about a Rick Russ? Any Rick Russ? Somebody named Freddie Barack has sent him a package. Anybody? What is that? Sounds like a skunk. You're tuned into the Russ Belville Show, the voice of the marijuana nation, only on CannabisRadio.com.
Welcome back, everybody. 38 after the hour, live from Scottsdale, Arizona. We're talking about this cover story on Harper's magazine, Legalize All Drugs. Now, the author here, Dan Baum's done a really good job of exploring all angles of this issue, and he gets around to talking with Mark Kleiman. He's the public policy professor at New York University. He's been a longtime critic of the war on drugs, but kind of does it from a cynical public health perspective. And a point that he brings up is, we keep saying there's this tiny number of people who are drug addicts, less than 8% using... Well, I'm sorry, drug users, monthly drug users. Again, we don't know that they're addicts necessarily, but Kleiman argues that one of the reasons why we might have so few hard drug addicts is because they are illegal. That maybe there is something about the illegality that is depressing those numbers. And he worries about how legalization of all drugs might have a platform sort of effect. He says that there's no evidence indicating that the number of cocaine abusers would be less than the number of alcoholics if both were legal, right? And for this, he's pointing out that cocaine and alcohol have virtually the same addictive potential. A lot of people don't know that. National Institutes of Drug Abuse say that about 15% of the people who ever try alcohol become alcoholics. About 17% who ever try cocaine become cocaine addicts, dependent, I should say. And I might have those numbers backwards. It might be 17 for alcohol and 15 for cocaine, but they're relatively close, right? So an argument here might be that, if cocaine were as legal as Coors Light, would there be a whole lot more cocaine addicts? Would there be 17.6 million cocaine addicts like there are 17.6 million alcoholics? And Kleiman adds that these legalizing other drugs might have a cross-platform effect. He says, quote, "A limit to alcoholism is you fall asleep. Cocaine fixes that. A limit to cocaine addiction is you can't sleep. Alcohol fixes that." So the worry here is, wow, if we legalize the stimulant, cocaine, it might make alcoholism worse, and the alcoholism might make the cocaine addiction worse. The only problem with Kleiman's theory is that we have some analogs to this. We have some preliminary data. We've got Portugal. Portugal has decriminalized all drugs. Any personal amount of drugs that you have are legal. Or not legal, I should say decriminalized. You're not going to go to jail for them. In fact, this is what Harper's writes, is the Netherlands effectively decriminalized marijuana use and possession in 1976. Australia, the Czech Republic, Italy, Germany, New York State all followed suit. In none of these jurisdictions did marijuana become a significant health or public order problem. So in Portugal, in 2001, decriminalized coke, heroin, and the rest of the drugs. The drugs are technically prohibited. You still can't sell them, but purchasing, using, and possession up to 10 days supply are just tickets, administrative offenses. No other country's gone so far, and the results have been astounding. The expected wave of drug tourists never materialized. Teenage use went up shortly before and after, but then it settled down, perhaps as the novelty wore off. The lifetime prevalence of adult drug use in Portugal rose slightly, but problem drug use, that is the habitual use of hard drugs, declined after Portugal decriminalized from 7.6 to 6.8 per 1,000. In Italy, which didn't decriminalize, rates rose from 6.0 to 8.6 per 1,000 during the same time span. And since addicts can legally obtain sterile needles in Portugal, decrim has radically cut the number of addicts infected with HIV from 907 back in 2000 to just 267 in 2008. And full-blown AIDS among needle users fell from 506 to 108. And their prison population, the number of inmates serving time for drug offenses, fell by more than half, and today they make up only 21% of those who are incarcerated. If we did something similar in the United States, 260,000 people would be freed. And we didn't see, as predicted by Mark Kleiman, any sort of mass increase because now cocaine was decriminalized and the alcoholics could stay up late. So, again, Mark Kleiman, always looking at the bad side of things. But another point that should be noted in this has to do with another one of Mark Kleiman's complaints. And he makes a complaint from a public safety perspective that when you look at alcohol, it's the alcoholics that keep the alcohol industry in business. That like 20% of the drinkers consume 80% of the alcohol. And there was a Washington Post piece that I saw last year that really starkly illustrated this. And it broke down the deciles of the United States, right? Decile meaning each 10% slice of the pie, right? And so they wrote, like when we look at the spectrum of people who drink in 10 separate slices, what we find is that the first 3 slices are people who don't drink at all. 30% of the population are absolute teetotalers. So your first 3 deciles of the population don't drink at all. And then your next deciles, like your 4th decile, 5th decile, 6th, 7th, 8th, we're all in that range of social drinker. Like, I'll have a beer once a week. I might have a wine at dinner, that kind of like 0.2 drinks a week versus, maybe 1 drink a week, kind of in that range for the next, 8 decile, or next 6 deciles, I should say. 5 deciles. So you find that The first 3 deciles, they don't drink at all. The next 5, they drink maybe 1 drink a week, if that. Then you got to the 9th decile, and the 9th decile was like a drink a day. Okay. Still where you wouldn't think, that's way out of line, right? A drink a day, that's not too bad. But you get to that 10th decile, it was amazing. It was like 10 drinks a day. It was crazy. And so, yeah, from that perspective, the alcohol industry is greatly dependent on these super heavy drinkers. And that brings up this worry about making drugs a for-profit industry, because in order to keep those profits going, you've got to encourage, either overtly or covertly, the mass increase in use by those heavy users. It's why Mark Kleiman and others in that field always laugh derisively when the alcohol ads say drink responsibly, because they always say, yeah, if people drank responsibly, the alcohol companies would be out of business. So now, with the legalization of marijuana and considering the legalization of other drugs, there's that same worry. If there were a legal cocaine industry, it would survive by creating cocaine addicts. And people that do a whole lot of cocaine tend to die. And so you'd have to keep replacing them. You'd have to keep making more and more cocaine addicts, right? So that's the worry. And I think there's a little bit of credence to this. In the Harper's piece, they write, already, legal marijuana in Colorado is following the grim economics of alcohol. Daily smokers make up only 23% of Colorado's pot smoking population, but they consume 67% of the reefer. Got that? Daily pot smokers in Colorado are less than a quarter of the pot smokers, but they smoke 2/3 of the weed. That may have been true too when marijuana was illegal. Maybe the number of daily stoners is neither rising nor falling. We'll never know, because one of the problems with illegal markets is you can't track them. But we do know that the legal for-profit marijuana business in Colorado is already mimicking the alcohol business in its dependence on heavy users. From a public health standpoint, that's troubling. Well, not as troubling as the heavy users of alcohol who get cirrhosis, cancer, and die. At least when we're talking about these daily pot smokers who smoke 2/3 of the weed in Colorado, we're not talking about anybody possibly dying. So when we're talking about cannabis, it's not, I don't think that concern about the for-profit nature of the cannabis business is anything to get too worked up about. Now, if you extend this to cocaine and heroin and meth, drugs that can be physically addictive and devastating, that may be a different story. And that goes back to what I was telling you earlier. What I was telling you earlier about don't get caught defending legalization of other drugs. Instead, force them to defend the prohibition and the punishment and the incarceration of keeping them illegal. In the case of coke, meth, or heroin, what becomes legal might be like what we see in Switzerland, where they have a heroin assistance. They have these places where heroin addicts can go and get free heroin only if they inject it on site where they have nurses and medical staff ready. And what they find is that these people end up getting off heroin. They tend to want to reduce their dose until the point they can get off heroin. And the clinics there help heroin users to get jobs and to get housing, right? So they try, again, like I was saying with Rat Park, they try to make their circumstances in life a little more bearable. That may be what heroin legalization has to look like. Give them the heroin for free. There is no profit motive. It's all simply about harm reduction. And maybe the cocaine market needs to be something similar. Maybe cocaine is something you can get, but it requires a doctor's prescription. Or you have to register in some sort of way so that we can keep track of how much cocaine you're using. Maybe only people that can distribute cocaine is all for non-profit purposes, so we take some of that profit motive out of it. We're going to have to be very careful and considerate about how we think about legalizing other drugs, because the models we have for tobacco, alcohol, and cannabis may not be appropriate for these substances that have much more potential for harm. But the overriding theme I think we need to stick with is that nobody should be jailed. Nobody should be punished for what they choose to do to themselves. And we should never have a situation that empowers criminal organizations to make profits off of these substances. Clearly, criminalization is something that cannot be allowed to stand. We cannot continue to allow criminals to make profits off of addictive substances. Now, fixing that may not mean letting corporations make profits off these addictive substances. It might require some sort of government monopoly. It might require some sort of public health model. But it's time for us in the marijuana movement to start considering this and to start thinking about what's next. Once we get marijuana where we want it to be, what's next? And I think from a moral standpoint, we can't fight for our right to do to our bodies what we choose with cannabis and ignore the right for anybody else to do what they choose to do to their body with some other substance. All right, we're going to take a break, and when we come back, we'll get the show all wrapped up and ready for Stoner Jesus coming to you live at the top of the hour.
This is the Russ Belville Show on CannabisRadio.com.
Chung is ready to cut through the smoke and change the tone of Tilk Radio.
I hope everybody's got their vape pen handy, or their pipe, or their bong, or whatever you use to do your medicine.
But you don't. It's not a requirement. You don't have to be high for this show.
Yeah, you do. Okay. I don't know who you're talking to. You have to be high to do anything. At least I do. I don't know about you. In fact, I've been high so long that being straight is another high.
The Tommy Chung Podcast, only on CannabisRadio.com.
Welcome to my world.
The Russ Belville Show, providing dictionaries to drug czars since 2009.
Georgia. Hi, this is Willie Nelson. Alcohol prohibition didn't work in the 1920s, and marijuana prohibition isn't working today. It's time we stopped arresting responsible marijuana smokers. It's the fair thing to do.
For more information, contact NORML, the National Organization for the Reform of Marijuana Laws. Call toll-free 888-67-NORML or visit their website at norml.org.
We have your smoking section right here. This is the Cannabis Radio Network.
With over 6 years of experience in the industry, New Era CPAs is one of the nation's leading cannabis accounting firms, helping hundreds of growers, dispensaries, and ancillary companies with their tax, legal, and business strategies. New Era CPAs offices cover the West Coast from Seattle to San Diego, and their skilled team is always available to help you take your business to the next level. Visit neweracpas.com for more info and set up a consultation. Welcome to the new era.
Yarr, thar be pirates here. Har, 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 har.
You're tuned into the Russ Belville Show, the voice of the marijuana nation, only on CannabisRadio.com.
Thank you, Dan Michaels. Welcome back, everybody. Winding up the week here on CannabisRadio.com, but reminding you to join us next week on the Russ Belville Show. Got all sorts of great guests joining us. On Monday, we'll be talking with Dr. Mitch Earlywine. You can get your live cannabis questions answered. On Tuesday, we've got our activist agenda. Patrick Nightingale will be joining us to discuss Pennsylvania's new medical marijuana law. On Thursday, we'll have another guest from Cops Say Legalize Drugs. That's our law enforcement against prohibition guest. They'll be joining us on Thursday. And next Friday, we've got Alec Rockford from Doobie who will be joining us. Doobie is a new social media platform for the cannabis community. We'll be talking to him about it coming up this Friday. Also, looking forward to next month. Oh my goodness, April, we begin the marijuana season. It begins April 2nd with the Ann Arbor Hash Bash in Ann Arbor, Michigan, the longest running protest for marijuana legalization. And on that same day in Washington, D.C., there's the D.C. smokeout protest that's happening. Adam Eidinger and those folks are calling on President Obama to deschedule marijuana before he leaves. Then all sorts of things happening. Oh, my goodness. April 10th and 11th, the CanMed Conference in Boston, Massachusetts. April 14th through 16th, the Patients at a Time Conference in Baltimore, Maryland. April 17th and 18th, Mark Kleiman, who we were just talking about, is hosting a cannabis summit in New York at New York University. And then April 19th through the 21st, the United Nations General Assembly Special Session, the international session to discuss our drug treaties at the UN. The last UN General Assembly Special Session on drugs was 1998, and it was their goal was a drug-free world in 10 years. How's that working out for you, fellas? So now they're talking about how the United States has 4 states and its capital that have legalized. So why should all the rest of the countries have to put up with these international drug treaties? We're going to cover all of that here on CannabisRadio.com, and I'm really looking forward to bringing it to you. April 23rd and 24th, there is a medical cannabis conference in Arcata, California. April 24th, that Sunday, I will be in Eugene, Oregon for the Oregon Marijuana Business Conference. Looking forward to that one because the keynote speakers will be Tommy Chong and Dr. Carl Hart. And I am so looking forward to getting a chance to interview Dr. Carl Hart. I can't stand it. And then at the end of April, the Unity Torch will be making its way down the East Coast, and it'll be stopping in Atlanta, Georgia. I hope to make my way to Atlanta for that particular event. Should be a lot of fun. Then, looking toward May, we've got the Global Marijuana March. It's May 7th. It's always the first Saturday in May. I'm going to make my way out to Fort Worth, Texas, and join the folks at DFW Normal in their march. But check your city because there's 300 cities all across the country and around the world that participate on that May 7th day for Global Cannabis March. May 9th through the 11th, there is a Florida Medical Marijuana Business Conference in Orlando. I'll be making my way to Florida to cover that. May 14th and 15th, I have been confirmed to be the MC for the Northwest Cannabis Classic in Anchorage, Alaska. It'll be my second trip back to Anchorage. Looking forward to that. May 22nd through the 24th is the normal DC fly-in. This is where activists from all around the country, from normal chapters, fly to Washington, D.C., get some training on congressional lobbying, and then hit the halls of Congress to lobby the legislators for marijuana law reform. We'll be covering most, if not all, of those events here on CannabisRadio.com. Follow me at Radical Russ on Twitter and Facebook, and I'll make sure to give you all the updates. You can also follow me on Instagram for my pictures from all around the country. But that's all the time we got for today. We got to call it a day. Stoner Jesus is coming up next live here on CannabisRadio.com, so stay tuned for that. For everyone here at Cannabis Radio in Scottsdale, Arizona, I'm Radical Russ. Thanks for joining us. Until next time, take care of each other, tokers.
This is the Russ Belville Show. The Russ Belville Show is blogging and podcasting daily at RadicalRuss.com.
You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it. You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it. You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it, and it goes down smooth.